This learning module was created by Nipissing University's Best Practice Spotlight Organization team based on the Registered Nurses Association of Ontario's Best Practice Guideline, Engaging Clients Who Use Substances. The Nipissing University BSCN program is undergoing a pre-designation to become a Best Practice Spotlight organization. This project is funded by the RNAO in conjunction with the Ministry of Health and Long-Term Care. Disclosure. This presentation is based on the Registered Nurses Association of Ontario's Best Practice Guideline, Engaging Clients Who Use Substances. This graphic demonstrates how to use best practice guidelines based on your academic year. First year, knowledge of the best practice guideline and assessment using the best practice guidelines. This is also an introduction to best practice guideline order sets. In second year, clinical exposure to application of best practice guidelines. Third year is knowledge and use of best practice guidelines in complex settings. And fourth and fifth year is the application of best practice guidelines in complex scenarios, utilizing more critical thinking. When reviewing this guideline for application, it should be applied in accordance with the individual, the organization's needs, and the practice setting. This guideline provides an overview of supports and appropriate structures in order to provide the best possible evidence-based care. This video further looks into the best practice guideline, engaging clients who use substances. Substance use. The administration or ingestion of psychoactive substances. Examples of these substances include tobacco, alcohol, illegal drugs, caffeine, medications, glues, and solvents. These substances can either be harmful or beneficial depending on the context of use, the method, frequency, and the substance that is being used. One thing to keep in mind, not all substance use leads to difficult behavior. It is circumstantial. Specific situations, depending on the type of substance consumed, can further lead to psychological and physical health problems. Substance abuse has no correlation to an individual's socioeconomic status or geographic location. It has the power to affect anyone. Substance use disorder, commonly referred to as addiction. Following the DSM-5, the definition is a cluster of cognitive, behavioral, and psychological symptoms indicating that the individual continues using the substance despite significant substance-related problems, based on pathological displays of behavior, risky use, pharmacological criteria, social impairment, and impaired control. The three most commonly used psychoactive substances in Canada: alcohol, cannabis, and tobacco. Globally, Canada has the second highest level of prescription opioid use. Examples are morphine, oxycodone, and codeine. There is a gap between the number of individuals with substance abuse disorders along with the number who are accessing resources to receive help with their substance abuse disorder. In 2012, 4.4% of Canadians were identified to have a substance use disorder. Only 0.4% went and accessed publicly funded services and interventions. This proposes a need for better identification of these services and awareness of substance use disorders. Risk factors of substance use disorders. Biological or physiological vulnerability, example PTSD, mental or physical illness. Genetics, internal factors, example coping skills. External psychosocial factors, example stressors, trauma, family and friend situations. And the social determinants of health. Physiological versus physical dependence. Physiological dependence is a pattern of substance use and craving due to the effects of the substance, most often triggered by an environmental cue of previous use. Physiological withdrawal symptoms: anxious, irritable, or mood lability. Physical dependence. A tolerance is developed to a substance, so the individual increases the amount that is consumed in order to reach the desired effects. Physical withdrawal symptoms: nausea, vomiting, palpitations, and tremors. This graphic outlines the process of developing a substance use disorder. The stigma around substance use disorder. Martin and Johnston describe a stigma as a social process that is depicted with patterns of blame, rejection, devaluation, or exclusion as a result of an anticipated or past experience to conclude to a social judgment about an individual or group. Substance abuse disorders are often grouped by society from a moral or criminal perspective rather than as a health concern. Livingston notes that stigma leads to poor outcomes, including delayed recovery, poor mental and physical health, delayed reintegration, increased involvement in risky behavior, and barriers to engagement diminishing outcome of therapeutic interventions. This video depicts the stigma around substance abuse disorders. In the next few slides, we will outline frameworks used within the guideline. The first framework is the social determinants of health. When working with individuals who experience substance use disorders, it is important to identify the social determinants that affect their overall health. Consider the individual's social supports, income and social status, personal coping skills, and education. As nurses, there is responsibility of incorporating these determinants into a patient's plan of care, including assessments, plans, interventions, and their overall health goals. Number 2, population health promotion model. The purpose of population health promotion is to reduce the health inequities faced by large groups and in turn improve a population's overall health. This model demonstrates how the health of a population can be improved with the use of health promotion strategies and interventions that work specifically on the factors and conditions that affect a population's health. You'll see on the front of the cube, there's a list of social determinants. On the right of the cube, there's comprehensive action strategies. And on the top of the cube, there are level of actions. Number 3, trans-theoretical method of change. This model was designed to describe the process of behavior change. Keep in mind that change is individualized and non-linear. Utilizing the TTM model allows for nurses to assess the individual based on the stage in which they are in the change process, engaging them in interventions related to their specific needs. Number 4, harm reduction. The purpose of harm reduction is to minimize the adverse effects of substance use disorder without the individual abstaining from those substances, as harm reduction recognizes that substance use is complex in nature. This framework is based on advocating for equal services and resources while maintaining a non-judgmental attitude. It is designed for health practitioners to be involved in the care of these individuals and provide interventions within their environment where the substances are used rather than take them out of that context. Nurses are able to follow this approach by meeting with clients in their environment and establishing goals with the client so they can be the center of their plan of care, in turn further developing the nurse-patient therapeutic relationship. Before this approach is used, it is crucial that nurses recognize their own biases and opinions towards substance use disorder. Number 5, trauma-informed approaches to care. Many individuals who have experienced a traumatic event turn to substance use as a form of coping with their symptoms. When working with these patients, using a trauma-informed perspective is crucial, as trauma is often a potential cause of substance abuse. This results in a nurse-patient relationship that is free from violence and judgment with a focus on collaboration. Number 6, cultural competence and cultural safety. The RNAO describes cultural competency as the application of skills, knowledge, attitude, and personal attributes that nurses use to provide appropriate care to communities, groups, or individuals. Nurses must continue to instill cultural competency in their practice and make sure that there is no stereotyping that can lead to further stigmatization or marginalization. Number 7, recovery perspective. Recovery is individualized, a journey, internal change, ongoing, and patient-driven. Recovery is a continuous process that involves many ailments, including overcoming stigmatization, becoming engaged in social activities and within the community, accepting individual vulnerabilities, and working to regain hope, responsibility, and control in their life. The recovery perspective is one that often occurs outside or following professional intervention, as it is client-driven and an ongoing process. Once the nurse addresses this, it emphasizes the importance of the individual's long-term management and participation in their care. To the left, there is an algorithm for engaging clients who use substances. The expert panel on this guideline created an algorithm that touches on all of the practice and education recommendations that should be implemented across practice settings. How the algorithm is used is dependent on client factors, the healthcare provider, and the healthcare environment. 3 pathways are included. Pathway number 1 is screening the individuals to determine whether they are using substances. Pathway 2 is brief intervention, plan of care, and assisting with supports. And pathway number 3 is comprehensive assessment, plan of care, intervention, and evaluation. Best practice recommendations are provided in 3 areas. Number 1 is practice, frontline interprofessional team who provide care to individual across all practice settings. 2 is education, those who provide interprofessional and staff education. And number 3, system, organization, and policy. This can vary depending on the recommendation. It can include administration, managers, government bodies, policymakers, or regulatory bodies. As nursing students, the focus will be on practice recommendations. It is still beneficial to be aware of the educational and system, organization, and policy recommendations as well. What is a gap analysis? It's the difference between current knowledge and practices, so what we are currently doing, and current evidence-based practices, so what we should be doing. Gaps can occur in knowledge, skills, or practice. It is important when you look through this guideline to reflect on the following questions and be specific. Where is our current practice? Where do we wish we were / where should we be? Why has this gap occurred? And how are we going to close this gap? Performing a gap analysis on best practice guidelines is an essential part of reflecting on practice. When reviewing the recommendations, identify where there are gaps in current practice or knowledge and take the time to reflect. Steps to conduct a gap analysis. Step 1. Perform a needs assessment. Step 2. Determine the educational gaps in knowledge, skills, or practice. What is the best practice? Step 3. Determine purpose of the activity and program objectives and design. Step 4 is course development. Step 5, implement the activity. And step 6 is to evaluate the activity. Now we will begin to look at the recommendations from the Registered Nurses Association of Ontario's Best Practice Guideline, engaging clients who use substances. Objective number 1, assessment. 1.1, screen all clients to determine whether they use substances. 1.2, for clients who use substances, use universal screening questions and/or an appropriate screening tool to determine the level of support required. 1.3, conduct a comprehensive assessment with all clients who screen positive for substance use, as appropriate, based on the nurse's knowledge, skill, time, setting, and resources. Objective 2, planning. 2.1, build collaborative relationships with clients through the use of motivational interviewing techniques to develop the plan of care. Objective 3, implementation. 3.1, use brief intervention to collaborate with clients identified as at risk for or experiencing a substance use disorder. 3.2, advocate for and support access to combined pharmacological and psychosocial interventions as appropriate and promote the appropriate use of combined interventions to improve well-being and health outcomes. 3.3, engage youth and adolescents at risk for or experiencing a substance use disorder using family-based therapies until recovery as appropriate. Objective 4, evaluation. 4.1, reassess the effectiveness of the plan of care until the client's goals are met. Listed below are the education and system, organization, and policy recommendations related to this best practice guideline for your reference. Objective 5, education recommendations. 5.1, integrate theory and clinical practice opportunities regarding care of clients at risk for or experiencing a substance use disorder into the undergraduate education of nurses and other healthcare providers. 5.2, healthcare providers participate in continuing education to enhance their ability to assess and work with clients at risk for or experiencing a substance use disorder. 5.3. Nurses practice reflectively to enhance their awareness of their current and evolving attitudes, perceptions, and biases, and values and beliefs when working with clients at risk for or experiencing a substance use disorder. Objective 6. System, organization, and policy recommendations. 6.1. Advocate for improved health outcomes by increasing access to integrative and collaborative care for clients at risk for or experiencing a substance use disorder, and reducing health inequities by dedicating resources to preventing, treating, and supporting the recovery of individuals at risk for or experiencing a substance use disorder. 6.2. Organizations integrate prevention, assessment, and management of substance use and substance use disorders as a strategic clinical priority across all care settings. 6.3. Organizations integrate components of harm reduction and the social determinants of health into comprehensive, multifaceted approaches to addressing substance use disorders. 6.4. Organizations use knowledge translation processes and multifaceted strategies to integrate best practices in the assessment and management of substance use and substance use disorders across all practice settings. This diagram represents research gaps and further implications. Substance use is a complex topic that still requires further research to identify further recommendations and validate the current ones. This will lead to improved patient care and outcomes. This diagram highlights the Registered Nurses Association of Ontario Mental Health and Addictions Initiative. The goal of this is to enhance evidence-based care and services related to mental health and addictions across all settings. The objective is to increase capacity among nurses and other healthcare professionals to implement and sustain evidence-based mental health and addiction best practices in all settings and advocate for organizational, policy, and system changes. There is a pocket guide available for engaging clients who use substances.